Hello, I'm Jacqueline Small, President of the Royal Australasian College of Physicians. We, as members of the RACP, are committed to serving the health of our people. This remains true from the earliest days of our basic training to the later years of our professional life. As a medical college, our core responsibility is to train the next generation of physicians and paediatricians and to maintain the highest standard throughout our careers. But advocacy to improve the health of our patients and communities is also an important college activity. Australia at 82.9 years and Aotearoa New Zealand at 81.7 years life expectancies are ranked highly by the World Health Organization at 7th and 16th in the world respectively. Yet these data don't tell the whole story. There remain significant health inequities, with remote Indigenous people in Australia having 16 years shorter life expectancy than the general population. Maori life expectancy is 8 years shorter than the general population. In my own field of intellectual disability, the preventable premature mortality is at least 20 years shorter. We can do better. In 2022, our college developed a 5-year policy and advocacy plan. This not only speaks to what we will focus on, but also how we will advocate. We will centre your voice and your role in our influence and engage with consumers, including our own consumer advisory group. We will use the lens of the quadruple aim that acknowledges the importance of the health and well-being of our workforce, and we will focus on issues that you have told us are important. These include Indigenous health, climate change, priority populations and health reform. I want to share just some of what we've been doing over the last busy few months. Advocacy that you may not necessarily be aware of. We have engaged heavily with Australia's new federal government to set the college up as a trusted advisor, including meeting with the Minister of Health, Mark Butler, and the Australian Protection Principal Committee. We have also met with several MPs, including members of our college, who hold important roles in government, such as Dr. Mike Freelander. We've been meeting with Australia's Departments of Health, Education and the Treasury. We have advocated for the reinstatement of telehealth item numbers, the National Medicines Policy, COVID vaccinations for children and silicosis. Aotearoa has focused on its Make It the Norm campaign to address socio-economic determinants of health. We also speak to the importance of new models of integrated care that better addresses the needs of those with complex or chronic health problems. As a paediatrician, I'm very proud that we are leading the Kids COVID Catch-Up campaign. The pandemic led to setbacks for our children, and we are aiming to help our kids get back on track. Our recommendations include a national chief paediatrician, restricting marketing of unhealthy diets to children, and funding the National Children's Mental Health and Wellbeing Strategy. Hundreds of RACP members with other health professionals and parents signed up to support us, and it worked. The Health Minister committed to a rapid review of support for children with disabilities in schools. In addition, the government committed to improving mental health support in schools as part of a $440 million package. Climate change is a major risk to our healthcare system. Yet our health system itself contributes 7% of our carbon emissions, higher than many other countries. We're calling on political leaders to create a climate-ready and climate-friendly health system through our Healthy Climate Future campaign. We joined forces with 10 other medical colleges, amounting to 100,000 medical specialists across Australia and New Zealand, to review research on the impacts of climate change on the health system. Thank you to those who recently completed our climate change survey to help guide our future work. To those of you who haven't, please complete the Healthy Climate Future survey by the 30th of September. With the Victorian election around the corner, there's still time to act. Your college is calling all paediatricians and child health physicians working in Victoria to complete a short 10-minute survey. It will ask you how COVID-19 has impacted healthcare for children and young people. Please help us drive change by completing the survey before Friday the 30th of September. I want to thank CPAC for its leadership. We recently welcomed an enthusiastic trainee to the College Policy and Advocacy Executive Committee, a first for this very busy committee. Speaking up and driving change is who we are as physicians and paediatricians. I ask you to join with me in driving this change. Together we can make a difference. Thank you for watching.